I grew up in a household where my mother is a nurse and my father is a chemical engineer, so science was always at the forefront. I always knew I wanted to go into some sort of medicine or medical career, and for whatever reason, I really just loved my pediatrician growing up, so went into medical school thinking I would be a pediatrician. My OBGYN rotation really showed me how you could have a long-term relationship outside of pediatrics, and I really loved that. And then had the opportunity to be exposed to the field of fertility and just saw how powerful it was. This is a field that is relatively young, and the science behind it is changing so quickly, and it's just so cool to me how that can immediately impact the care of patients. I did my undergraduate at University of Texas at Austin and got a major in business. Then I moved to Galveston where I did my medical education at UTMB. And then after that, I moved to New York and did my training there for 7 years, both residency and fellowship at Cornell at New York Presbyterian Hospital. The most important thing to me is really getting to know my patients because their specific history, needs, goals are what really puts together the plan on how we will care for them. When my husband and I decided to start trying to have a baby in my second year of fellowship, I ironically became one of those who struggled with infertility, which I never expected, but it honestly was the best education I could have ever received. It totally changed the way that I approach patient care, and I think even though it was one of the hardest things I've ever gone through, it really changes the relationship that I have with my patients in that I can understand them on such a different level.